Blog Talk Radio.
The purple angel, oh purple angel, you're next to me. Purple angel, oh purple angel, you're next to me. You're next to me. You're next to me.
Well, hello, everyone, and welcome to Alzheimer Speaks Radio. I'm your host and founder of Alzheimer Speaks, Lori LeBay. And basically, I developed Alzheimer Speaks because my mother was on this journey with dementia for 30 years, and I found it to be actually such a blessing to me in how it changed my life. And so I decided to launch a new company called Alzheimer Speaks, one that's advocacy-based, providing multiple platforms to shift our dementia care culture from crisis to comfort around the world. Here at Alzheimer Speaks, we believe in joining forces, in sharing knowledge, and having everyday, honest conversations about life with dementia. We really believe that's the only way we're going to remove the stigmas and the myths attached to memory loss and be able to really help those dealing with the disease and diagnosed with the disease live with purpose. Together, we feel we can help everyone understand the true needs, again, just by having an open, simple conversation. At our core, we believe collaboration is the only way that we're going to win this battle against dementia. And I know it's working because of all of your likes, all of your clicks, all of your shares with your Facebook family, with your Google Circle, with your LinkedIn pals. It's just been absolutely incredible. You see, because of all of your sharing of information, you've made Alzheimer Speaks the number one influencer online regarding Alzheimer's, according to ShareCare, who is the largest health and wellness website in the world, and Dr. Oz. And again, that would not have been possible without all of you. And I feel it's so critical that we share the information that comes by us regarding this disease, because there are people in need that don't even know how many resources exist. And that's really one of our goals here, is to help people share simply great information out there to make their life easier and to be able to allow them to live a dignified, purposeful life. So again, from the bottom of my heart, I thank you all for doing just such a fantastic job in terms of sharing information. It really is making a critical difference to so many. And I know that from the letters and the comments that I receive from people all around the world. Today, we have a couple of great guests, as usual, but I would like to also remind you that we want to hear your voice. So don't be shy about calling into the show. The number is 714-364-4757. Again, that's 714-364-4757, or you can always use the chat box as well to communicate with us. In our upcoming shows, the next couple of shows, we're going to have a little bit more open mic sessions because, again, we just really want to hear from you. You guys have such great ideas. It's really phenomenal to be able to hear from you. So let me go ahead and introduce our first guest today. Lisa Barron came highly recommended from somebody who I just treasure, Carol Larkin. And many of you know Carol for her work that she has done. She writes incredible articles and is just really out in the forefront. She does a lot with memory cafes and just a very powerful and sincere woman on a mission to help shift our dementia care culture. And she said, you've got to get to know this woman, Lisa Barron. Lisa is the founder and executive director who established Memory Care Home Solutions, and she wanted to bring service that was unique to our nation and to families who are caring at home for a loved one with memory loss, dementia, and or Alzheimer's disease. During her 5 years prior to founding Memory Care, she served as general counsel and director of development for Park Province, the largest senior care facility in Missouri for those with Alzheimer's disease. At the same time she did that, she served as general counsel. Her mother-in-law was suffering from Alzheimer's disease. She and her husband and their 4 daughters became so aware of the unmet needs of people who are caring for those with dementia. And she realized the need for training and community resources and information that's really accessible at a home-based level. Because of her personal and professional passion to provide dementia care, she decided to launch Memory Care Home Solutions in 2002. To date, the organization has served thousands of individuals, and in 2011, she received the Leadership Service Award for her participation in the 2009 to 2012 State Alzheimer's Task Force, which was a panel of 18 members statewide. And if you're not familiar with NAPA and all the state plans, check at your state level and get involved. There's a lot of really cool things happening. In 2009, Lisa was invited to join the United States Senators Healthcare Advisory Panel, and she has also received an Innovation Award in leadership training for managers from the Dale Carnegie Institute in March of 2008. So this is a woman who really has made some great strides in really a short period of time. So welcome, Lisa. How are you doing today?
Fine. Thank you so much, Lori, for this wonderful opportunity. As I was telling you before we began, one of our biggest challenges is getting out the word. So shows like this really help us connect with the caregivers. We are here to serve who we want to serve, who we believe can greatly benefit from our service. So thank you for helping all of us connect.
Well, it's a long overdue need out there, and I know I surely felt it during my 30-year journey with my mom. And every time I go to speak at a conference, people are shocked at the amount of services and information and resources that are available, but people just don't even know where to go and
exactly.
where to find them. And so, again, it's very important that we have, these simple conversations regarding services. So let's talk about yours. Can you tell us, why did you decide to focus on the caregiver versus the person with dementia?
Sure. And I think that really goes to the founding of the organization and the recognition that there was a void in services for caregivers. As you had mentioned, Lori, I had been part of the caregiving team for my mother-in-law, and there was a large team of siblings who all live coast to coast. That is, she has 3 sons and 1 daughter who live between California and Washington, D.C., and she had a very dedicated primary caregiver, her spouse, my father-in-law, Charles, and none of us really knew how to handle what we were facing. We didn't know how to handle the wandering, the weight loss, the sleepless nights, the constant repetition. And we all convened a meeting here in St. Louis and called on a geriatric care manager to help guide us through what we were experiencing, what we would possibly experience in the future, and what were our options. So here we had this fairly educated group of caregivers, and we had no idea how to handle what we were dealing with. And we figured if this is our experience, there are probably many, many, many caregivers who are experiencing the same thing, that lack of insight into the disease itself, and then also how to treat it, how to care for it as a caregiver when you want to do a terrific job, but you don't necessarily know how. But the second part of why we focused on the caregiver was that for us, probably about 6 to 8 years into the diagnosis, Betty was actually doing fine, although she wasn't necessarily cognitively connected to the reality of her environment. What we became very concerned about was my father-in-law. So our conversations were all around his health, his well-being, his sleep, how engaged he was, so that he would have the strength and the quality of life to take care of himself and my mother-in-law. So that was another reason. We found our family focus ultimately really focused on Charles most of the time, that caregiver. So that was another reason why we decided to really direct our services to the caregiver at Memory Care Home Solutions.
Oh, that's wonderful, and you're so right. I talked with so many people, as I'm sure you do, that are in the industry, and they are shocked at how different it is when you're caring for your own loved one. And it's like taking the bag and dumping all your toys out on the floor, because nothing is what it seemed to be prior to being personally touched. And I've actually had people, one administrator of 21 years break down just sobbing in tears when I spoke, going, I've given advice and I've talked with people day after day after day for 21 years, and he said, I've just been doing it all wrong. I had no idea what it was like to sit on this side of the plate. And he says, this has changed me forever. And I'm going to communicate much differently. Not that I'm going to change the tools that I'm recommending, but the way in which I distribute them and the way that I communicate with people. He said it'll never be the same again. Because
right,
it's just
right.
It's just very, very, very different.
And that, you're right, it's so true that people's backgrounds, their professional backgrounds, really play a role in how they are as a caregiver. We came from a family of lawyers used to knowing the answers. This is not a disease where there are answers. It is trial and error every day. And as organic as the disease is, that's as flexible as caregivers have to be. And a lot of what we do, Lori, is go into the homes and help caregivers to look at the situations that they've been dealing with possibly for years and help them to see it in a slightly different way than they have in the past.
Mm-hmm. Which is great, which is exactly, my next question is, in terms of adapting the home setting, is this an evaluation? Is there a fee for this? Can you kind of tell people, how do you work with families in terms of assessing this?
Sure. So you'd like me to really focus on adapting the home setting at this point.
Mm-hmm.
And so that is only part of what we do, but I'm happy to talk about it. And first and foremost, all of our services are offered entirely free of charge. All of our services are offered entirely free of charge, and that is due to the incredibly generous nature of local and regional donors, private donors, foundations, collaborators, and we're so appreciative to them. I really can't say that enough. So no one is denied service for inability to pay, and the initial piece of what we do is we actually go to the people's homes when it is convenient for them, and we meet with the entire family, everyone who would like to be present. If any paid caregivers would like to be present, they can join us, but we're really focused on family caregivers. And we get to know them. We get to know the most difficult issues with which they are dealing, and then we we ask to see their home. So this is the environmental kind of assessment that we're doing, but it's not an evaluation as much as seeing how their environment is working for them. So looking at their kitchen and looking for all of the possible hazards of a kitchen. Are there knobs that can easily be turned on by the person who's affected with cognitive impairment? If there are, we give them safety knobs and we help them put them on immediately. Are there drawers where pills or knives are being kept that are not secure and safe? Because we can immediately install latches and guards for those that are adult-friendly, that are not juvenile-looking, that are age-appropriate. Are there is there a sink where it's possible that the flooding can occur and we can put a motion sensor activation system in place? So there are many things just in the kitchen alone that we can look at, but then we'll go into the bedroom. Is there a closet that's filled with so many choices that someone with Alzheimer's is absolutely overwhelmed? We can help take out many of those choices for them and simplify their environment. Or maybe the person with dementia doesn't know where their socks are or their underwear. We can put signs up, either words if they can still read, or pictures on maybe just a couple of the drawers so they won't once again be overwhelmed, to help them identify and cue where their items are so they can maintain the abilities that they still have and get dressed if they can appropriately. We'll go into the bathroom, which is just a whole universe of complexity in and of itself for the caregiver also, and we'll make sure that things like the caregiver is able to reach everything that they need in a sort of 2-foot radius. So when they're assisting someone with their loved one with toileting, they can reach whatever they need. We'll look at the sink and make sure that for purposes of hygiene, teeth cleaning, brushing the hair, that only those items that are absolutely necessary are in the line of vision so that the person who's affected can make sure that, or can see what they need to do. Maybe they don't remember any longer that the toothpaste goes on the toothbrush. Then we'll train the caregiver to make sure that toothpaste is on the toothbrush so that the person can continue to brush their teeth themselves. But that's just kind of a flavor of when we do a home assessment, a home tour, those are the kinds of things that we're looking for to be able to help people and to give them those assistive devices immediately, or to connect them with someone who can expertly put in grab bars along the shower or going upstairs so that it's done properly and by a professional.
Wonderful. Now, with these adaptive devices, I know that your evaluation, you said, was free. Is there a charge for, the items themselves?
Right. So most of the items we are able to provide to the family. And if we can't, we will connect them in a way, I'd say 90% of the time, where they do not have to pay, because we know about resources where these things are being donated. So really, it's virtually covered by our organization.
Incredible. That is absolutely incredible.
Well, it's such a joy to be able to provide this, really.
Yeah, it is. I'm going to pull in, if you don't mind, Harry Urban, who's with us. And Harry has dementia, and I would just love to hear his thoughts on what it is you're doing. So let me see if he's still here. Harry, are you still with us?
I sure am. Can you hear me?
We can hear you. We can hear you. Well, what do you think about what Lisa's doing here?
I tell you what, I am so excited about that. I wish we had something like that in Pennsylvania. Just the things that she was talking about, some of those things I never thought about, and it would be so nice if now I do mentoring through a local hospital here, and it would be so nice when we speak to newly diagnosed patients with dementia, that if we can mention this organization that will come in and do a house tour and help the caregiver learn about this disease. I think that's wonderful. I need more information.
Yeah, it's pretty exciting. Question for you, Lisa. Do you guys have any plans on expanding at all around the nation in terms of your services?
So really, the vision of this organization is that every single family that could benefit from this service would receive it. That is the big vision, that all of the Harrys and Harry's probably wonderful family could get this kind of care and this kind of interest. It is definitely part of our overarching plan, and we're trying to develop as many partnerships nationwide as possible to see that come to fruition.
Okay. Because it's just absolutely incredible. And, when you were talking, I was thinking, this is, a lot of what you're talking about is not only great for somebody with dementia, but I'm just thinking even, I've got a granddaughter that's around quite a bit now, and I'm knowing that I'm hiding the scissors and putting, stuff just out of eye contact. Just because of her, she's curious about things. And I'm just thinking a lot of what you said could apply for so many other things, or keeping things on a shelf, that's more accessible so people aren't, getting on a stool to grab something and maybe falling off. If it's the caregiver or the person with dementia, it's just a lot of simple safety things that are just very, very applicable in many, many ways. Makes an awful lot of sense for people. What kind of response do you get from people when you go after you go out to their home?
Sure. So, I just want to follow up on a comment you just made about broadening the reach of the families that we're serving, because we definitely are asked that. And I want to make it clear that Memory Care Home Solutions helps any families who are caring for someone with any form of memory impairment, whether it's due to Alzheimer's or the many, many different forms of dementia or stroke. So it's much broader than just Alzheimer's or the things that people are most familiar with. It includes stroke, and I think that's important because, as we know, many, many heart issues, when people are discharged with things like pneumonia or CHF or MCI, they all have some form of dementia. And so it's really a very, very far-reaching program in and of itself. But what we hear from caregivers, just to get to your question, what do we hear from families? You are a godsend. I'm so happy I'm not alone. That is a huge thing, just that we are there for them. It's wonderful to go into their homes, but I think part of the impact is not just when we're there, it's afterwards, because now we have really seen this family with no shields, with nothing but the honesty of what they're dealing with. It's not like going to a doctor's office where you can say, well, we're really doing okay, but the caregiver will go home and feel totally under the water. We're there. We're seeing the family. We're seeing what they're struggling with. And after that, they feel very connected to us and very very much like they're sharing this with someone else who knows the truth about what they're going through. So I think the fact that we come in is great, but what we hear is, thank you so much for joining me in this journey. I'm so glad I have someone else I can talk with, who I can ask about resources, who really understands our family dynamic. Just that we've seen oftentimes families who are struggling with who's in charge and are we all on the same page, and this isn't fair. So I think that's the overriding feeling of gratitude has to do with that.
Okay.
The other thing that you mentioned, Lori, is that there are so many incredible resources out there, and families simply don't know about them. They don't know about free things that are available for them. Whether it's respite care or Meals on Wheels, these things are there for them, and we help connect them to those resources immediately.
which is absolutely fantastic because such a huge, huge need. Now, we do have somebody on the line from a 951 number that's got a question, so I'm just going to, a question or a comment, so I'm just going to pull them in. 951 number, you're live and on the air if you want to state your name.
Yeah, this is Rich from Riverside. How are you, Lori?
Good, good, good. Did you have a question or a comment, Rich?
Couple of comments mostly. First of all, congratulations to Lisa for getting the memory care home solutions going. I'd never heard of it until today, but
Thank you.
I do want to emphasize how challenging it is when you become a caregiver for the first time. These aren't things they teach you in school growing up, how to tend to someone, especially if you're a male tending to a female. There's a lot of different dynamics to learn, and to me, just being able to, in my case, I was able to keep my wife at home till she passed away, and it just is so important and so valuable to do that.
I'd like to, yeah, Lori, if it's okay. Rich, I so appreciate your call. As a caregiver, as a male caregiver, as someone who was incredibly dedicated at keeping his wife at home as long as he could, which was until the end. And I really honor your service and devotion to her. But it brings up another program that we have been fortunate enough to receive generous funding from Missouri Foundation for Health for, which is that we've expanded our program to involve occupational therapy, which means that we're going into homes and offering people up to 4 visits to help with hands-on training, which is with the most basic needs that a person with Alzheimer's has. So what I've really heard from the feedback from the occupational therapists who are going into the home is they are helping lots of men, and they're helping men caring for women with the most basic needs, toileting, showering. Like you said, this is absolutely not something that you were trained to do, but you've accepted that role and you want to do it well, and you want to do it in the most professional way possible. And my hat's off to you, but I will say that you represent a lot of people out there who need that sort of help.
And I want to thank you for being on the radio. It's word of mouth, and when I was going through this, I wasn't aware of anything that was out there that was available. And just to give you kind of an analogy from the mind of a caregiver, when you know you're dealing with Alzheimer's and you've researched it, it's almost like you're digging a grave, and you get to a point where you've dug the grave, and then, at one point when the situation turns, and you see where it's going, you feel like you're filling it in, and to have someone come in and even put a handrail in just lightens that load on your back, and that's what it means to the caregiver, so you know.
It is a great analogy. I really appreciate that. I really appreciate it. Thank you. Thank you.
Well, thanks for calling in, Rich. Appreciate your comments here. So wonderful. And others of you, if you're out there and if you have comments or questions, please feel free to call in at any time. We love to hear from you. All you have to do is call 714-364-4757. Again, that's 714-364-4757. And if you have a question or comment, push 1, and that will let me know that you're in the queue. And then after you're done, some people like to listen that way on the phone, which you can do. Just push 1 again. That should remove kind of that little question mark that I'll see. And then if you have another comment or question later on, you can push your 1 again, and I'll be able to see that you have another comment or question to make or to add, because we would love to hear from you. Well, so interesting, such interesting work that you're doing, Lisa. It's just absolutely fabulous. What do you see is the most pertinent thing that caregivers need, during this kind of challenging time?
Sure. So, Lori, just in answering that question, I want to flesh out a little bit more about our program and why I think it is what caregivers need and why we've received such great response from them. So While the program begins with an initial home visit in which we get to know the family and their home environment and see the resources that they need, we follow up with a caregiver strategy plan. And in that plan, we identify things that will help make the caregiver's life better and will help the person with Alzheimer's or dementia function on their highest level and connect them with those resources. And then we follow up. So we go to our office after the home visit. We'll call, let's say, for example, an adult daycare. And we'll say, do you have openings? Do you have transportation? Can we sign this person up? So it's very, very hands-on assistance because caregivers are stressed out. They have enough on their plate. The last thing they need from us is a list of things for them to do. We do those things for them. Let's say we find out that a caregiver has been going out for lunch with their sister every week for 3 years, and now they've let that go. That's really important to institute that again. Or let's say that a family is looking for some sort of dementia screening on a professional level. We'll connect them with the clinics that we know here and help them get in the queue for that. And then we'll follow up. So we send them the strategy plan with all of the things that we recommend and all of the things we've been able to do for them. And then we call them again at 3 months and find out how they are doing and whether they've implemented these suggestions. Have they gone to the diagnostic clinic? Are they going out for lunch with their sister again? Have they been able to implement some of the strategies related, let's say, to toileting or showering that we've recommended or taught? And then we follow up again at 6 months and at 12 months. So I think the fact that we have this overarching relationship with them, that we're able to help them in a crisis mode with the initial home visit, and then we stay with them for an extended period of time and beyond, is really the most positive thing that we've heard from caregivers. It's having that go-to relationship and not being alone.
Wow, that's fabulous because I know so many times it's that follow-up, it's that feeling like they're part of a team and that they're not alone. That's probably one of the most devastating pieces that I hear over and over and over again, and I'm sure that our friend Harry hears that as well. And I'm just going to pull Harry back in because I think that that's a really critical piece. Harry, are you still with us?
Sure am.
So what do you think about
everything.
They do this evaluation, then they go back and kind of devise a plan and follow up? I'm just so impressed because this is such a huge need that I hear, and I can't even begin to imagine how much comfort that it brings to a family. What would something like this have done for you in Pennsylvania where you live?
Oh my goodness, I'm so excited about this. I need information on how we can partner up to get that here. Not only does this program benefit the caregivers in the later stage of dementia, but it would be so beneficial for the newly caregivers that the loved ones have just been diagnosed. It's incredible that a program hasn't come up like this before. I mean, it's so wonderful that you think, well, this would have been one of the first things that somebody would have thought of. But I'm amazed at this because when we do speaking events, the caregivers, they're always asking about this kind of stuff. And to be honest with you, we have no information to give out. You know, it's like a gold mine that's hidden and nobody knows about it, but once you know about it, it's, oh my goodness, why didn't I hear about that? And that's how I feel about this. It would be so nice if evaluations could be set up with caregivers from the get-go so they know what's coming up, so they know what to look for, things like that, because it doesn't come with the book. You know, there's
right.
there's no user manual with this disease, and you learn as you go. Well, if you had the opportunity to know little things ahead of time, I think that would make the journey so much easier.
You know, another thing, Harry, another reason why I think it would be so important to expand this program nationally is we've spoken a lot about the quality of life for the caregiver, and that's been the focus of a lot of our discussion. But one of the things that is a huge impact for our program and that we're so proud of is that we're able to reduce healthcare utilization costs. So with our program, you know, if you're taught by a professional who comes into your home, and we have only very experienced social workers and occupational therapists going into the home, but if you're taught what to do for dehydration or what to do about a urinary tract infection or bed sores, these sorts of things that people are bringing their loved one to an emergency room for can be avoided. So when we go in on our initial home visit, we ask people to give us a history of the number of hospital stays they've had, how long they've been there, or how many times they've called 911, how many times have they had to run to the doctor unnecessarily. And what we've been able to find is that with this training, we've been able to decrease readmissions to hospitals by 58%. We've decreased 911 calls by 53%, and we've decreased ER visits, emergency room visits, by 41%. That's just enormous savings to the private and public sector. And there are so many reasons, like you said, to have an expanded program so that all people, and quite frankly, our healthcare system, could be benefiting from this.
Oh, definitely so, definitely so. And like Harry said, it's amazing that this isn't in every state, in every county, in every city, because this is such a high need. And, you know, I don't know if you're familiar with Harry, but Harry Urban is a mover and shaker in the world of dementia, and he has a Facebook page called Forget Me Nots. He was part of launching Dementia Mentors, where people, once they get diagnosed, can actually be hooked up with someone who has been diagnosed with the disease, so they know what it feels like. So, I mean, it's right in that basic step of learning how to live with the disease and not become it. And he just is an incredible voice, and you know, it's amazing the things that he has gotten done. So Harry might be a really actually great resource for you in terms of trying to get this expanded if you need if you need a voice kind of from that angle. And even myself, in terms of talk, you know, when I go out and speak, I'm always talking about new and different things that are out there, and sharing with people, you know, what others are doing. I'd be more than glad to share what you're doing as well, because it's such a critical piece. I just think it's fabulous. It really is very, very wonderful. So in terms of the you know, the evaluation and getting out there and doing you know, kind of the research for people, because you're so right, care partners just don't have the time to do all this research. And then following up, do you follow up more than once? Is this an ongoing relationship, or how does that work?
Sure. And I just want to say thank you both, because I see both of you as movers and shakers in this field, and if we can all collaborate, what we can achieve together can be much, much greater than what we can do individually. And I would look forward to future conversations, because the whole idea is to help as many people as possible nationwide.
Exactly.
But back to what the relationship with the families themselves, we go in, we meet them for that initial home visit. It's usually a couple hours long. It's very in-depth. And one of the other beautiful aspects of it is it brings all family members together who want to be present. So maybe that oldest daughter who's been carrying the weight of the world can now shift some of that to other siblings who are in town who might not even be aware of what she's involved with. And not only that, but the training that we're giving is the same training then given to all family members. So they all know how to deal with certain disruptive behaviors in the same way. So I'd say that family piece is critical. And then we send the caregiver strategy plan and help them put all of these strategies in place that we're recommending. We follow up at 3 months. The social worker or occupational therapist will call back and go through that strategy plan and say, hi, how are you doing? Have you been able to go out for lunch? Are you now offering popsicles to your loved one who you said is dehydrated all the time and refuses any sort of water? Have you put the grab bars in place with the help of the man that we connected you to? Is your loved one going to the adult daycare? So, and then we, of course, ask our questions regarding healthcare utilization. Have you had to go to the emergency room? Have you had to go to the hospital for any reason? Have you had to call 911? So we continue to gather that data and to show the impact of the program and to, of course, hear how they're doing so we can help them. And then we follow up again at 6 months with the same sort of phone call, and we follow up again at the end of the year after 12 months of service, and we send a survey and get some real critical feedback from them. But I think what's most important is that we're available via email and phone anytime that they want help, and that is huge. So if something else comes up for them, they can immediately contact us and talk to someone who really knows their situation, who knows their doctors, their family, the person who's suffering with the disease. And they can get very expert advice quickly. So that's the relationship. There are some people, Lori and Harry, that we've been able to help for years, honestly, who keep calling us, and we're happy to serve them. And that would go for all of our caregivers. It's just not as common that they continue to call for years, but we're there to help.
Mm-hmm. Wonderful. Well, that's absolutely fantastic. Gosh, we've only got about 20 minutes left in the show here. There is somebody in your area at a 314 number, and I don't know if they want to ask a question, so I'm just going to pose if you are on the line and want to ask a question, you have to push 1 so that I'll know that you're in queue. Otherwise, I'm going to think that you're just listening. So if you want to ask a question or make a comment, just to go ahead and push 1. And then in the meantime, do you have like written material for like safety strategies or anything that you recommend, or do you do that kind of more verbally as you're meeting with people and so that you can be more specific?
Sure. So when we meet with the family, we do a number of things that have to do with safety. We tour the home. We're able to make recommendations right there on the spot, and as I mentioned, we'll bring assistive devices and put them on right then and there, and we'll connect them with other people who can help install these different techniques, different devices. But we also are starting to use technology in a more specific, targeted way. So we're able to show YouTube videos of how to do certain things related to safety, which is really wonderful. You can't necessarily. Sometimes it helps for someone to actually see how to transfer, how to help someone go from a standing position into a car seat, how to swing their legs around. So all these sorts of things can really be expanded, and safety teaching can be expanded through technology, which is wonderful.
Well, that's great. That is absolutely great,
so
and I agree.
Customized.
Yeah, I agree. It is helpful for people a lot of times to actually be able to see specifically versus just taking it all in. It can get overwhelming with all the details, and then for you to actually not only state this is what's needed, because that just adds to somebody's to-do list, but to actually make those changes while you're out there, or to hook them up and make appointments to get other things done that your company is not able to do. That's just absolutely incredible. Absolutely incredible. I can't imagine what a relief that would be to family, in terms of giving care. Now, do you do like additional type of training for care partners as well? Do you do like educational training, or just throwing that out there? It sounds like you've got
Sure.
everything covered. So,
No, we definitely do broader-based training. So we'll do, we appear at health fairs. We do employee workshops. So we're talking about a specific topic. We'll speak at churches or synagogues about how to talk to someone with Alzheimer's, or talking about healthy brain aging. And those are really informative talks, and they're also, quite frankly, an opportunity to let people know that a service like ours is there. We also speak at conferences, and we'll highlight the work that we're doing and the outcomes, the impact of what we've been able to show to date. So the other thing that we are just starting to do is we're piloting some professional training, and we're also doing family caregiver training, because we've bought a home in which the entire first floor is set up as a unique caregiver training environment. So we have a bathroom, kitchen, bedroom set up with our assistive devices, and we're able to show people there and do training right here, because maybe there's a family who's not ready for us to come in and meet with their loved one, their person who's affected with dementia, but they're ready for some training themselves. They can come here and in a kind of a private, safe environment, learn strategies and techniques and see what we have to offer.
Oh, wonderful. That's wonderful. Now, I know when you had met with Carol, I think she had gone through and took pictures of some of the different things that you show in your training center, like marking
exactly.
Drawers and things like that. And I know that's something that I did with my mom when she was living in the nursing home, and people go, oh, that looks tacky. And it's like, it's functional for her to be able to be independent, to mark what is in what drawer for her, and just made it so much easier and less frustrating for her. What do you hear about comments like that, or what's your belief in doing things like that?
Right. And I know what you're saying, that there's kind of, sometimes some of these things can bump up against what people think is aesthetically pleasing. But you're doing it for the sake of functioning ability. When we designed our facility, I was working with an interior decorator in the kitchen, and for the training kitchen, we had picked out black equipment for the refrigerator and the stove, and then realized, oh my gosh, we totally can't do that, because so many people with Alzheimer's perceive black as a whole. And so we switched all of that out for the sake of the training and for the sake of functioning ability, and it's all chrome or white now. So that's kind of a big lesson in what do I think priorities should be. Certainly not the aesthetics, and certainly the functioning ability of the person with Alzheimer's. But I think you also can do things in a way that is beautiful. So I'll give you an example of something that we have that's very low tech and low budget and pleasing. Is that in the bathroom there's a large mirror in our training venue, and often, as we know, people with Alzheimer's are scared of their own image, whether they don't recognize their image, whether they're scared that another person is there. It can be terrifying for them to see their face in the mirror. So what we have set up is a really lovely picture that is framed, and it's all on cardboard, so it's light, and then Velcro pieces that attach to the mirror. So the frame of the mirror looks like kind of the second frame of the picture, and that is there above the sink, and when the person with Alzheimer's comes into the bathroom, that's what they see. And then if someone else who doesn't have Alzheimer's wants to use the mirror, they can simply take this little Velcro picture down and use the mirror. So I think there's ways to do things where it looks nice. Even the cueing techniques that you're talking about for drawers or cabinets or doors, We have really lovely laminated signs that we bring to people. They're typed out. The words are typed out if the person still is able to read. And the pictures that we use are also, they're not juvenile. They're from magazines, let's say, and they're like I said, laminated, small, discreet, but still noticeable by the person with Alzheimer's. So I think there are things that you can do that work for everyone who's going to be using the environment.
Mhm. Well, that makes sense. I'm just going to pull Harry back in and to see what his thoughts are. Harry, what are your thoughts about, labeling drawers or cabinets and things? Is that, I don't know if that's something that you do at this point in your home, but as the disease progresses, what are your thoughts about labeling?
That's so important, Lloyd. Now, everybody thinks their home is safe, but it's not. Very, very few homes are safe. Now, what I say that you might have the knives locked away and whatever, the knobs off the stoves and everything else, but we have to think of ways to prevent me from wandering out of the house without putting me in a jail. Everybody says, well, we'll just put locks on the door. But that doesn't work. That might confine me in, but that's not solving my problem. Little things like that. I would like to see things like sometimes you forget where the bathroom is. Maybe it's little pictures on the door that designates it's a bathroom. Little things like that. Now, we take so many of those things for granted that we know where everything is, but for somebody with dementia, they don't know that. Simple things like the phone. You don't want to easy access phone to somebody with dementia because if I get bored, I'm going to call somebody, and who knows who that's going to be. And that could cause a lot of problems. Things like if I'm in charge of taking my own medication, I might forget it. Things like that. And what happens if I say, oops, I took my evening medication and not my morning medication? Should I take my morning medication in the evening and then my morning in, things like that. There's so many steps that like a checklist that we can inform the caregivers of things that they have to look out for.
Mm-hmm. Hey, Harry, I think the bathroom is a huge issue, and I'm so glad that you mentioned it because that certainly is one of our signs that we give to people is a big sign saying this is the bathroom or showing a picture of a toilet. But and certainly keeping the door open so that it's in the line of sight. But a couple of other things that we do related to the bathroom also are that we will install for people or give them the tape if they want, reflector tape, so they can put that on the hallway from the bedroom to the bathroom or from the kitchen to the bathroom. So that it's a wayfinding technique. And also giving people night lights so they can see the path illuminated at night. Those are huge things, and I agree with you. They're simple, they're easy, but caregivers take for granted that somebody still remembers, oh, of course they know where the bathroom is. And as far as the phone goes, I think that's a huge issue, and especially with people with dementia who might call their child who's at work, but then call them repeatedly because they don't remember, of course, that they had already, saying, do you have my meds yet? Do you have my meds yet? And for the caregiver, the child, the son or daughter who's trying to be productive at work, that can be so difficult and frustrating. But there's also an issue of sometimes people with Alzheimer's don't remember who they're calling, or they won't remember the number of who they want to reach. So there are wonderful phones that we also tell people about that have the picture of whom they want to call, a big picture where the numbers are. So all they have to do is press that picture, and that family member will be called. So there's lots of things out there, and then the last thing that I wanted to touch on was medical management, which you also highlighted. And these, Harry, you've done a beautiful job of highlighting for me what are some of the key things that we're dealing with here. And the medical management piece is there are so many different systems to put in place depending on what is appropriate for the caregiver. Certainly there are pill boxes that we can give people and help them organize and understand what can be taken when. But also there's great systems out there now where, electronic systems, where if the pill box is opened, through a computer program, the caregiver is notified that pill box has been opened, or the refrigerator has been opened, so that the caregiver knows what sort of activity is going on, and they'll know this remotely while they're caring for someone.
Great, that's wonderful. I know with the pictures for the phone, we use that with my mom, and by the time we got the phone, she was too far along in the disease where that didn't make any sense either, and that's why it's so critical for people to be able to connect with you earlier than later, because you really do have just some fantastic services that you're offering people. And in all of these are really going to reduce the kind of caregiver burden, if it can make life easier for not only the person with dementia but the caregiver as well. I mean, what a nice thing to know that you're bringing peace to families and comfort. That's just fantastic. Lisa, we just have about 4 minutes left, so I'm going to let you talk on whatever we haven't talked about yet that you'd like to highlight for our audience, and we want to make sure that we give them out your contact information as well. Okay,
would you like me to do that? Do you want me to give my contact information?
Yeah, I have, your website here I've got as www.memorycarehs.org. And then I have got an email address, and I don't know if they can email directly from your website, but I know that you, if I remember correctly, you have a new program director.
That's correct.
Jill.
Her name is Jill Cigliana. And
okay.
She would be happy to receive emails, absolutely. And I'm happy to give both of our email addresses.
Okay.
Jill is J. Cigliana, JCIGLIANA at memorycarehs.org. And mine is L. Barron at memorycarehs.org. And that's LBARON. And our phone number is 314-645-6247. One of the things that we hear, thank you so much for this opportunity. We are here to serve. That's why we exist. So one of the things that I hear so often is, I wish we had known about you earlier in the process, and is there an organization like yours in the state in which we live? And at this point, we are happy to serve everyone. And we are tracking, keeping a very careful list of the people that we're serving nationwide. There is nothing we'd rather do than give a virtual home visit, than have people from out of state participate in our program, and for us to be able to follow up with them like we do with everyone here in Missouri. And we'd have a home visit with them. We'd follow up at 3, 6, and 12 months. We'd be available for phone calls or for emails. That's why we're here.
Wonderful. So that's a fantastic thing for people to know, that you could do a virtual tour.
Absolutely.
Now, to do a virtual tour, would somebody need to have like an iPhone or something where they could do FaceTime, or be able to carry their computer around so you could see the home in different areas, or do you just kind of talk them through?
Ideally, they would have some sort of way for us to see what is going on in their home. And we could talk about different ways of doing that, certainly FaceTime and Skype, but maybe someone only has camera abilities. They could send us pictures. That would be ideal. But even if they don't necessarily want the home assessment piece, we can still help them, and we can help them in terms of geriatric counseling. But the biggest impact for our program really is helping people in their homes, so the FaceTime or Skype would be the ideal way to do it. And if they wanted to initiate that, they would call us, they would speak with Jill or anybody on the program team. We would send them materials for them to complete like we do here, and those materials would be completed and sent back to us so that we could have our initial home visit and follow up throughout the year.
Wonderful. It looks like we've got another question here. This is from somebody at a 314 number. 314, you are live and on the air if you want to state your name and your question or comment.
Good morning. My name is Ed, and I'm on the board of Memory Care, and I just wanted to thank you for having Lisa on, and wanted to say the company I work for, Watlow Electric, fully supports Memory Care and their caring for families and caregivers.
Oh, wonderful. Well, thank you for your support of Lisa's company, because it is really making a huge difference, and we are all jealous it's not in our state. So we're going to want to figure out how to get this expanded, and maybe there's some grant opportunities to be able to expand that into other areas, because what a fabulous service you guys are providing. So thank you, Ed, for calling in.
You're more than welcome.
Thank you.
Lori, one of the reasons why this is not available nationwide is because we're not a covered service under the Center for Medicare and Medicaid at this point. So we are able to offer this free of charge purely because of companies like Watlow and other wonderful, generous funders who make that possible. People don't need a diagnosis. They don't need to have a minimum income, although we help everyone, and 54% of the people we're serving are making $20,000 or less annually. But there's no eligibility requirements other than having a caregiver.
Wow. That's amazing. That is absolutely amazing. Well, our time has flown by today, Lisa, and I'm so glad that Carol Larkin made this connection. I'm very excited about the work you're doing, and I'll help you in any fashion that I can in terms of raising awareness. So thank you again.
Harry. Wow.
Yeah, Harry.
Thank you both.
Harry is incredible. Again, you can go to the website memorycarehs.org, or feel free to give them a holler at 314-645-6247. Thank you so much, Lisa, for being with us today.
Thank you. Thank you for the opportunity and for the beautiful work you do. Bye-bye.
Bye. Before I introduce our next guest here, I do want to just do some mid-program highlights here really quickly. For those of you that had a chance to listen to our last radio show, or those of you that didn't, we talked about tips for the holiday, and it was really a fantastic show. Lots of great information. And so if you haven't listened to it, go ahead and listen to it, and feel free to share that with other people. Just wonderful information. Next week, we are going to have open mic, but we are also going to have Us Against Alzheimer's. There are a few of their clergy represented, and they're going to talk about a new book that they just launched called Seasons of Caring, and it's meditations for Alzheimer's and dementia caregivers. And that'll be a really fun conversation. And we will also be having next week a Dementia Chats. We're still having difficulty with the recording. For whatever reason, poor Harry Urban was part of the process. We could all hear him. We could all see him. And when it recorded, he's blacked out. And so I have not posted that recording yet because Adobe Connect is still trying to figure that out. There are also a couple of blogs that I just wanted to mention. One is a letter called Dear Santa, and it's a child's wish for Christmas at Grandma's house again. And then there was another one that was I reblogged from a gal who has dementia, and she's got suggestions for better understanding audio communications with people with dementia, despite their symptoms and things. And then I also want to give a plug for Alzheimer's Music Connect. They are just, so fabulous, and they have some great holiday music, and I'm just going to give you a sample of one with their new CD out called Memories, the Songs and Spirit of Christmas. But they also have a lot of other CDs and MP3s that are available. There's one that is music for Alzheimer's and dementia, and it gives comfort not only to the patients, but relief for the caregivers, and that's a great package. So we're just going to listen to a short clip of one of their songs.
Chestnuts roasting on an open fire, Jack Frost nipping at your nose, Yuletide carols being sung by your choir and folks dressed up like Eskimos. Everybody knows.
So again, if you're looking for a great holiday CD, Alzheimer's Music Connect, go check them out. They've got a lot of great music, and they have some technology that's patent pending that actually helps people, not only with dementia, but us in general, pay attention a little bit longer. And I know it's great upbeat music, and something that you will definitely enjoy. I also want to give a shout out to Alzheimer's Disease International. If you're looking for an Alzheimer's association anywhere in the world, check out Alzheimer's Disease International. They are the association of all the Alzheimer's associations. You'll also get a great global feel of what's going on in the world, and they just published their last research paper. I want to say it was in September or October on things that you can do to help prevent dementia. The Alzheimer's Research and Prevention Foundation is another great organization. If you are looking for alternative ways to live with this disease, there you'll learn about exercise, diet, and meditation. There are also organizations for specific types of dementia that have their own symptoms that can be very, very helpful. The Lewy Body Association, the Association for Frontal Temporal Degeneration, or known as FTD, and then the National Aphasia Organization when people are having problems with speech. Each of those can give you some great insight and support. And then for some other gift ideas, there is Puzzle with Me. Jane Snyder developed a puzzle that has fewer pieces, larger size, more adult-appropriate pictures, and then Jiminy Wicket, which is really about engagement. It's an adaptive croquet game that can be played inside or outside, and can even be played by somebody in a wheelchair. So check those out. And then last, I have to give big kudos out to Health Star Home Health here in Minnesota. They're just doing phenomenal work. I get to see them tomorrow. They have launched a memory cafe and are looking at probably doing some more in the future. And I'm just so thrilled to be able to work with them. They really have some great insights. They have been gone through the certification of the Alzheimer's Whisperer program too, and just a really great home health care agency that gets this disease. So let me go ahead and introduce our second guest today. We have the privilege of having Dr. Benjamin Mast with us, and he is a licensed clinical psychologist and an associate professor and vice chair in the Department of Psychology and Brain Science at the University of Louisville. And he is the author of a recently published book on faith and Alzheimer's disease entitled Second Forgetting, Remembering the Power of Gospel During Alzheimer's Disease. So welcome, Dr. Mast. How are you doing today?
I'm doing great, Lori. Thanks so much for having me on today.
Well, I'm really excited to have you on. This book is, I think, a very powerful book, and will help a lot of people. Why? First of all, I should ask: have you personally been touched by the disease? Our audience always likes to know.
Yeah, that's right. So the short answer is yes, and the longer answer is I was in middle school when one of my grandfathers started to develop Alzheimer's disease, and my other grandfather developed Alzheimer's much more recently, and both have passed away now. But yeah, I was introduced to Alzheimer's through the way that many families are. We saw my grandfather visit us each summer, and he would ask us questions over and over again and seem more confused. And like many people, we weren't really ready to accept that it might be Alzheimer's disease, so we continued to come up with other explanations for why he was having trouble remembering. Until one day, I was sitting in a college classroom, and I got pulled out of the class, and somebody had told me that my grandfather disappeared. And what had happened, so what had happened was he was a retired plumber, and he really enjoyed going to his union meetings every week, and he continued to drive himself there each week, and that week he didn't come home that night, and so obviously we were very worried. And it turns out he turned up the next day some 300 miles away and had gone for a drive, and of course this was, we were grateful that he was okay, but it was a clear indication that something more significant was going on. It wasn't just his hearing. It wasn't that he wasn't paying attention. It was something like Alzheimer's disease. That left quite an impression upon me, and it has to be at least part of why I've been so driven to continue to work with people who have dementia.
Wow, that had to be just so scary to have somebody go missing like that and to be found so far away.
Yeah, that's right. It left an impression on me now as a psychologist who works with families who are facing Alzheimer's disease to realize some of those emotional and interpersonal dynamics that go into finally recognizing that something significant is going on and then taking further steps to go and get it checked out. It just, sometimes we say that people are in denial, and sometimes, we call it something else, but it's just very difficult to recognize what's happening when it first starts, and that gave me a greater appreciation for that.
Oh, I bet so. So what made you decide to write the book? That's a big decision to make because it's very time consuming to write a book. I think everybody thinks that they just fall on the shelf, but we all know better. It's a huge commitment to undertake.
Yeah, I'll be the first person to say they just don't fall onto the shelves. It's a lot of work, but it's in a sense a labor of love. And so I'm a professor here, but I'm also a clinical psychologist, a geropsychologist who works with families and individuals who are facing Alzheimer's disease. And over the past maybe 5 or 6 years, as I've been working with families, there's been two issues that have come up over and over. And I should say this new book, Second Forgetting, is a book that's written for people of the Christian faith, but it really holds a lot of person-centered dementia principles as well. So I think it has a broader audience in that way. But what I noticed in terms of this clinical practice was there were two common things that were coming up for people of faith that they really struggled with when it came to Alzheimer's disease and dementia. And the first is a whole assortment of both practical and theological issues related to faith and dementia. People would want to know, will my mother or father forget about God? Will she forget about her faith? And what does that mean for her soul? And they're just these very deep questions that I didn't know if anyone had started to explore yet, and I wanted to step into that. Because one of my goals as a clinician, as a professor, is for people to get the best care that meets them where they are. And I felt like that was a key emotional, spiritual issue. The other thing that would come up, though, was reported more by caregivers when I would ask them about where they were receiving support. And many of these caregivers have been people of faith, have been a part of a church for many years, if not decades. And what I heard more often than I would like was that they felt like once Alzheimer's set in and once the caregiving journey began, the people in the church and the pastors, the ministry staff just weren't there for them. And they felt very disappointed and sometimes hurt. And the more I dug into this, many of these pastors and church members really just feel like they didn't know how to step in. They don't understand Alzheimer's disease. They don't know what it's like to be a caregiver. And so I wanted to write this book not just to answer questions about faith and dementia, but also to educate and equip the church and pastors and ministry staff so that they can step in and be part of this journey, so that they can stay present and offer support and guidance and care.
Well, I think that is fantastic. Are you familiar with the organization Us Against Alzheimer's?
Yeah, actually, I'm a member of the Clergy Against Alzheimer's Network. I'm one of the founding members there. And, so I have,
okay.
So I've got 2 meditations in the Seasons of Caring, the book, which I heard you mention just before we came on.
Yep, I just got it, and I haven't had a chance to really look at it, but it looks fabulous because I was going to suggest if you weren't connected with them that you needed to do that because we're going to have them on this next week. So
it's great.
Few of the members,
It's
wonderful.
A fascinating book. Yes.
Well, good. Well, let's I'm really interested in the title of your book, Second Forgetting. Where did that come from? How are you framing that?
Yeah. So when we start to talk about Alzheimer's disease, obviously the memory impairment is obvious, very troubling, and it's really what causes families and healthcare providers to take notice that something significant is going on. This might be more than normal aging. So when we talk about this book called Second Forgetting, the first thing we have to understand is the first forgetting is the memory impairment of Alzheimer's disease that's caused by that degeneration in the medial temporal lobes, hippocampus. It's what we all have known if we've been around people with Alzheimer's disease. The second forgetting is something that's a little more broad, and as I said, this is a book written more from a faith perspective. And so the second forgetting refers to, for people who have believed in God and have had a faith for many years, second forgetting is essentially forgetting the Lord, forgetting God when we've been overwhelmed by something as significant as Alzheimer's disease. So this isn't something necessarily just for the person with dementia. It's also for caregivers, and it's also for the church more broadly. And it generally refers to the fact that for people of faith, you go throughout your life trusting in God, looking to Him for provision and care. But sometimes things happen to us that just seem so difficult and so overwhelming. It's as if we forget those foundational things in our lives, and we don't know what to do, and we begin to become afraid. And one of the things that's really interesting about the Bible is there are repeated calls by God to His people to remember Him in times of difficulty. And I found that fascinating as a person who's interested in Alzheimer's, that God wants us to remember. But what the stories of the Bible also talk about is when people are faced with an enemy that seems larger than they can conquer, which I would certainly put Alzheimer's in that category, they become prone to forget. They forget what God has done in their life already, the ways that He's taken them through difficult trials in the past. They tend to forget that He's with them in the present, even when things are hard. The Scriptures tell us that He's right there with us, still caring for us. And we tend to forget His promises for the future, that He'll go with us and that He's promising to take us through these things and to bring us into a much sweeter reality. So for Christians, oftentimes our hope is tied to our faith and remembering God. But the second forgetting refers to the fact that when people learn about what Alzheimer's entails, it terrifies them, and then they start to forget. And it's not just the forgetting to take medication, the forgetting to pay the bills. It's, in a sense, forgetting your faith and forgetting God and His promises.
Okay. That's interesting because one of the things that, and again, this is just my own personal experience with my mom and the people that I've I've been very close to with the disease and others that I've talked to, is that religion triggers so much. And so for me, what I have experienced is not seeing as many people forgetting that, but just the comfort that it brings to them. And what I guess what I have seen is people thinking that there's not a connection. You know, people on the outside looking in thinking that there is no connection anymore because they're now nonverbal. And I just see that peace that it brings. When a hymn is played or a prose is stated, or a prayer, that they do remember, because so much of it is ingrained from very long. And again, that's just what I have seen from my angle, but there's a variety. This disease affects everybody a little bit different there. So that's good to know.
Yeah, and I think, if I could step into that, I agree with you, and that's what I see. And I think, though, and you certainly know this, having been around this area for quite a while, when somebody starts to lose their ability to communicate, it's much harder to understand what's going on with them internally. And I think for many of us, it's understandably distressing, and there's a level of unknowability about what's going on inside that person. And so part of what I'm getting at in terms of this book is for families seeking to care for their loved ones spiritually, is that things like you mentioned, old hymns or familiar passages that the person knew from the Bible, can really offer them a form of spiritual remembrance that can offer them comfort in the present, even if they forget about it later. Those moments matter, and it's a part of meeting them where they're at and ministering to them in a way that's consistent with who they are and who they have been for many years. In a sense, it's a way of being person-centered, right? So to care for the individual, we have to understand who they are and what matters to them. And for those people who have had an enduring faith, this is part of providing good care for them.
Great. If you don't mind, I'd like to pull in Harry Urban. He actually has dementia, and just get his thoughts on this. I always think that it's just so interesting what he has to say. Harry, are you still there?
I sure am. I can almost guarantee you I will not ever have a second forgetting. Simply, now I say that because when I was diagnosed with Alzheimer's, I hit rock bottom. I had nothing to look forward to, and the only thing I could turn to was my faith, and I gave up my life to God. And my rewards since then, have been tenfold. I mean, I would not be able to do what I'm doing now if I didn't do that. And I think a lot of times we get it's thought of that we lost our religion because we can no longer attend church and things like that. But now, speaking for myself, I don't think I ever could, because that's what's keeping me alive. That's what gave me my passion to do what I do, and every day that's the first thing I think about. Every night it's the last thing I think about. And now I'm not. Don't misunderstand. I'm not a religious fanatic, but I am so deeply indebted to my religion that I couldn't live without it.
Mm-hmm. Dr. Mast, what do you think of Harry's comments?
No, I think it's a beautiful testimony to what I'm talking about, and I'm very grateful to hear that. I agree there are many people like you who essentially are clinging to their faith in a time of great difficulty where other things maybe seem to be slipping away. And in a sense, the second forgetting isn't a permanent forgetting. It's that momentary forgetting when we start to feel overwhelmed or panicked. But even when we have those, I think the call is to come back and to remember And as you said, Harry, to start the day and to end the day, remembering your faith and where your hope is. And I think that's a beautiful testimony. I appreciate you sharing it.
Yeah, thank you, Harry. And again, if we have others in the audience that are interested in sharing their thoughts, feel free to call in to 714-364-4757. Again, that's 714-364-4757. Or you can always use our chat box. I'll be moderating that as well. We'd love to hear from you. So, well, thank you again, Harry, for being part of the conversation. Dr. Mast, I wanted to talk with you on a few other things. You know, someone with Alzheimer's or dementia a lot of times can remember something that happened 30 years ago, but not something that happened, you know, this morning or 5 seconds ago. What are your thoughts regarding that, and how does your book apply to that?
So when we start to talk about memory changes in Alzheimer's disease, for many people who are very close to what's happening, it can start to feel like the person with Alzheimer's or another dementia really can't remember anything at all. And I think, in a sense, we have to remember that there are different aspects of our memory, or even different memory systems. And so the things that are most affected in Alzheimer's disease are really those recent memories and new learning. And certainly many of your listeners probably are familiar with this by now, that it's really the storage of new memories that's most affected in early Alzheimer's disease and beyond. But when we talk about other aspects of memory, we think about people's long-term autobiographical memories, or their memory for their story earlier in life. We think about what people will call procedural memories, or memories for actions or well-known habits, and even their emotional memories, so memories for the way that things felt, or remembering things that were particularly emotional at the time. And those are three aspects of memory in Alzheimer's disease that are relatively spared, at least for a while. And those are things that we can try to tap into when we're seeking to care for people well in a person-centered and spiritual way. And so, yeah, it isn't uncommon to hear people say, I can't understand why they can remember things that happened so long ago, but those recent things are gone. In a sense, that's the way Alzheimer's affects people. And the way that connects with the book, again, is if we're seeking to provide spiritual care to help people remain connected to their story of faith, we should look to draw on those three forms of memory that are relatively spared. They're memories for their long-term story, for habits and procedures, and emotional memories. And in a sense, these are things that you've talked about on your show many times when you talk about Alzheimer's and music. That really draws on all three, in a sense, that people don't even have to know they've sang a song before, but when it starts to play, they may recognize the words and join in. And it's a very powerful thing that caregivers who I interviewed for the book talked about when they were wondering whether the person with Alzheimer's disease that they cared for still had a faith and still remembered God. And they saw them then connect with an old hymn and see them light up, or even just sing each word quietly. They were so encouraged. And that has a lot to do with faith, and it has a lot to do with these various forms of memory.
Yeah, that ability to see somebody light up is such a gift, and is something that I think is so overlooked many times, and saddens me when people have kind of lost their faith in belief in their connection with another. And so it's kind of ironic that when I look at the title of your book, in some ways I apply it more to care families and care partners sometimes than the person with dementia.
Absolutely. Absolutely.
Where they're the ones who have lost faith on that level and need the reminding of how valuable they are, and how interconnected and intertwined we all are, and the power that we have to bring forth and to create these marvelous moments, no matter what stage somebody is in. It's absolutely I don't know. For me, it was just life changing on so many levels. To be able to be part of that, and to be able to know that you can connect on different levels, and the ability to teach unconditional love, which I kind of thought unconditional love. There's one type of unconditional love, but really there's many levels of it that anyways I found as I went through this disease, and beautiful lessons, that just really warm your heart and can touch the soul. And so I think your book is really important in helping people be able to connect. Can you tell us why it's important to interact with the memory system that's still working, when we're talking with somebody with Alzheimer's disease or another form of dementia?
Yeah, so when I think about how we should try to interact with people who have Alzheimer's or another dementia, hopefully our goal is to interact with them in a way that brings out the best in them and that connects with where they're still strong. Certainly we've seen or even been in interactions ourselves where we start with the most difficult question for somebody, where we say, do you remember who I am? Or do you remember yesterday when we did A, B, and C? And those are questions that for many people are very threatening questions. When you start with, do you remember? In a sense, it puts them on a spot in an area of their functioning where they're particularly weak. And so if we want to meet people where they are and draw upon the strengths in their memory, we'll start to interact with parts of their memory systems where they're more comfortable. So if you want to make somebody with Alzheimer's really uncomfortable, talk to them about things that rely on their recent memory, what happened this morning or what's going to happen tomorrow. But if you want to make people comfortable, talk about them where they know and have some mastery. So talk to them about things that happened many years ago, the stories that they know well. And in a sense, we're being compassionate by connecting with them where they still have good memory. And that's a generous, loving, and sacrificial thing to do. And so I think it's part of providing good care, but it's also part of just being loving to somebody who can't remember as well as you can.
Mm-hmm. One of the things that I liked in your book was just in one of the boxes, because I think that, caring for somebody and being a care partner can be very isolating at times and can be a really lonely journey, because we think that we have to do it all ourselves and nobody else can do it, no one else understands. And one of the things you have here is, as a caregiver, you can take comfort in the knowledge that you too have a caregiver, one who can surpassingly meet all of your needs. Christ is our caregiver. And, not everybody listening may believe in God, but hopefully you have a higher power that you believe in and can connect to, so that you know that you're not alone in this journey. Because, again, sometimes it can be so devastating and so isolating, and I call it kind of going into the river of denial, where you just have to have a pity party, and sometimes it lasts a minute, and sometimes it can last a couple of hours. But to be able to connect to your faith of why, one of the things I learned that to me on this 30-year journey with my mom was I learned to ask myself, what is it that I'm supposed to learn? And when I could flip that over and have a conversation, with my God about what is it I'm supposed to learn, an answer always came. And to me, that's how my life has gotten so beautifully enhanced, through these multiple lessons that can be applied not just for caring for my mom, but for everybody in the world that I interact with. It's changed how I view the world, how I look at the world, and so I think if we can tighten our connection to spirit and to grace, there's a lot that we're placed on this world to learn, and you can find so much and find so much calm when you have that connection to it's brought me, I know, a lot of peace, and it sounds like it's brought Harry a lot of peace, being connected to his faith as well. And when we lose something that can be that much of a powerful connection, or when we feel it's on the fringe, I mean, that's a really scary thing, and that can really put us in a huge upheaval. So I think a book like yours can help ground people again in terms of what's life really about, and getting back to some of the basics that sometimes we overlook, as we journey through life.
That's right. That's right.
And can be really important. Mm-hmm. Go ahead.
Yeah, well, I was just going to say, I think that is what it's about, is just bringing people back to the basics. And I love the way you put it about what can I learn today in the midst of this journey. And I think about, even your journey, and what I know just from following you is you've learned quite a bit, and now you've been able to share it to with other people. And it's just, you've gone through so much that's difficult, but now it benefits so many other people. And that's just a beautiful testimony to how even in the difficulties of life, there are many great things that can come out of it. And you can understand what that experience is like and be able to minister to others, regardless of whatever faith they might hold, because of what you've gone through.
Well,
and I think that question... Go ahead.
Mm-hmm. Oh, no, I'm sorry. Go ahead. I didn't mean to cut you off.
Well, I was just going to say that question of what can I learn today is such a great one. It's a very spiritual question. And, you brought up the example of Christ earlier that I had mentioned in the book. And, one of the famous sayings of Jesus that comes from the book of Matthew is essentially, I'm going to paraphrase and not say it word for word, but, come to me who are burdened and weary, and I will give you rest. It's such a beautiful thing, but what he follows it up with is essentially, take my yoke upon you and learn from me. And I think about that, and I think about the burdens and the challenges of providing care, and hearing the call to come to him, not only to find rest, but also to learn. And I think it really connects nicely with what you were saying about was your approach to caregiving. What can I learn today? And I think it's a really great question to ask.
Yeah, it's a very simple one, and the other thing that I found on my journey is that then I have to really shut up and listen for the answer, because sometimes your head is spinning at such a wild speed, thinking about what you've lost or what's coming in the future that scares you, and you have all this chatter going on that even when you're praying or meditating or however you choose to communicate, you can't hear the incoming because you haven't kind of diffused and gotten to that quiet space. And so for me, I've had to learn to quiet my mind and just push all that stuff aside and really say, really try to connect with my higher power, so that I can get the guidance that I'm asking for. And then sometimes it comes in really goofy forms, and it would be really easy to push it aside. And so I think the other piece is that we have to be strong enough to try something that might seem kind of strange. And I'll give an example of that if you don't mind.
No, that's great. Yep.
My mom was in the nursing home, and she was just having more difficulty, getting around, and so she needed basically to have a two-person transfer. And so in order to accommodate her needs, she had to move to kind of the lowest functioning community in her nursing home, and I was really nervous about that because she was still very social, but I understood the need for safety. And so they made the move, and they said stay away for a couple of days so she can adjust. And I go back to the nursing home, and I'm walking through where she used to sit and where she used to live, and my heart's just kind of sinking with every step, thinking, oh gosh, we're getting closer to the end,
Yeah.
And as the disease moved on, and I I get to her new unit and I hear her voice, and so I kind of pick up my pace, and then I realize my mom's madder than a wet hen, and she's swearing like a truck driver. I'm standing outside her door, and this was so not my mom, and my stomach's in a knot. My tears are pouring down my face, and I'm just praying outside her door for guidance, asking God to please help, because nobody should be in this much pain or this much fear that my mom is in right now. It's not right. It's not fair. And inside, I could hear two staff being really kind to her, just talking to her about getting up on her lift. Hi, Dorothy, we're here. We're going to take you down to lunch. We need your knees bent and your arms straight. We're going to push the button, and the machine's going to lift you out of bed. We're going to get you down to lunch with all your friends. And they're ping-ponging back and forth, and my mom is screaming. And so I gather up enough strength to push open the door. Nobody even knows that I've entered the room because my mom is just screaming like a mad hatter. And I'm still crying, and I'm still shaking, and I'm still praying, and all of a sudden I hear my dad's voice. And I feel an arm around my shoulder, and he says, "Ask her to go water skiing." And my dad had been gone for probably, close to 10 years. And I looked at the bed next to her thinking, okay, I'm having a nervous breakdown. I'm going to be in the bed next to her because like my mom can go water skiing, really, And then it hit me, and I walked up to the bed, and my mom is looking straight ahead, and she's kind of offset in the bed. She's got this like big seat belt around her back and ropes around her wrist for this machine to help lift her up, and she's kind of kittywampus. And I walked up to the bed at the edge of the bed, and I looked straight at her, and I said, "Mom, do you want to go water skiing?" And she turned her head from the staff directly at me, and in a nanosecond, she went from raving mad, beet red face to just this glorious smile, and looked at me and said, "Well, yeah, sure." And so I said, "Knees bent, arms straight," and I pointed to the man and I said, "Hit it." And this machine lifted my mom out of the bed. And my mom's arms went like they were holding a tow rope, though there was not one there. And one of the staff, screamed at my mom and said, "You go, Dorothy." And she winks at him, and in her mind, she's going water skiing. And I had to be brave enough to ask and to follow that guidance, because my dad always taught us all how to water ski. Everybody who came up to the lake, it was, knees bent, arms straight, hit it. Those were the three commands. And those three commands helped my mother get in and out of bed for months without fear. And so, again, we don't know what that guidance is going to look like all the time, or how it's going to come to us. And I could have easily poo-pooed that it was my dad, or it was a message from God, or however you wanted to look at it, and just said, "That's crazy." And I could have allowed my mom to continue to be in that pain and that fear, or I could choose to be brave enough to do something that seemed a little wacko because I had nothing to lose. So I think it's really important for us when we ask that we listen and then we act, because this disease, in my mind, is truly trial and error. And what might work one day might not work another. And I'm just going to pull Harry in really quickly and just ask him in terms of, Harry, if you were my mom, would you be game, to try different things, to try to bring you comfort, or would you rather have a family member not try? If something sounds a little strange.
You know better to ask that question than me.
That's right.
Of course, now, when I was diagnosed with Alzheimer's, I was given a gift. Now, when I was diagnosed, my old life died, and this new life started. And I can make this life whatever I wanted to. It was up to me. It was the choice I had. And I was given the wisdom and the passion to raise awareness, dementia awareness. That became my life. Now, in order for me to learn my trade, I had to live and learn by the different experiences. I can't pick up a book and tell me what it's like to go into the dark holes that we go into and come out of. Because if I read a book, I'm reading somebody else's perception of it. And I really can't talk about dementia awareness by somebody else's perception. It has to be my own. And that's why any new experiences that comes up or anything like that, I'm all for it because it's a learning ability for me. I have to be honest. I have to keep my integrity when I'm speaking about awareness. I can't sugarcoat anything. I can't. I have to tell it exactly the way I see it, and that's why I think my Alzheimer's was a gift.
Well, that's great, Harry. Thank you. The reason I asked that question, even though it might seem kind of silly, is I think sometimes care partners forget that a person with dementia or anybody with chronic illness or having difficulty would like us to try, would like us to have faith, and would like us to try to make things better, even if it might not work this time. Because I believe that the connection is still there, and that at least they're going to know we're trying, and that we haven't given up on them. And to me, that is one of to me that's kind of the core of faith is to be there, to be in that moment, and to be the best person that one can be. One of the things that I note that you have in the book is how can a church care for those with dementia and their caregivers? And can you talk about that? Because I think that is such a big piece that's missing, and so many churches now are just starting to understand that they need help in terms of delivering services in this area. Anyways, that's what I'm seeing. I don't know if you're seeing that, but I'm definitely seeing a huge shift, because I was hearing, like you had mentioned, kind of people leaving the church because they didn't feel like they belonged anymore, and so I think it's really important for churches to know how to care and support people dealing with this disease. Can you give us some glimpse in terms of some of your wisdom you have in the book regarding that?
Sure, I'd be happy to share some of the wisdom, but I want to credit it to some of the caregivers and care partners who I talked with, because one of the questions that I had for them was just this, how can churches step in and help provide care, and how could they better support you and minister to your needs? Because, as you said, some people are leaving churches because they don't feel like they have somebody who's caring for them. Others are just not going anymore on Sunday or on Saturday because it's difficult to get there, and they don't feel like they can bring their loved one, or they're afraid of what they'll do if they bring them into a service. And so one of the things that I try to emphasize is just because you don't show up for those formal services doesn't mean you're not part of the church. So how can the church provide better care? And what was really interesting to me, and it's a really nice segue from what you were just saying, is the number one thing that these people told me that they wanted from the church was just for the church to stay present with them on this journey. And, they felt as if, whether it's pastors or ministry leaders or other people that they know from the church, they just wanted somebody to continue to journey with them, to check in on them, to call them. I mean, one woman said to me, if somebody would just call me to check in on me and see how I'm doing, that would mean a lot. And I think, in a sense, there are many things that a church community can do to start to provide a dementia-specific or a caregiver ministry. But I think what we have to start with is be present and listen and seek to learn what it's like for that individual, for that family, and just be faithful in trying to take care of them. Because if we make it all about the techniques or the services and we haven't taken time to listen to what's going on in this individual's story and the uniqueness of it, we'll kind of miss it. Right? We can't really help somebody or seek to carry some of their burden if we haven't listened to them and to what it's like to walk in their shoes for a day or so. So that's the starting place. And once we really get to know somebody's situation, we get to know their longer story, the ways that we can step in will become more natural, whether it's providing some respite care or whether it's bringing a church service to them. So we don't have to have a whole congregation there. We can bring music. We could bring communion. We could bring a scripture reading to the person. One of the most meaningful interactions I had while writing this book was meeting with an older couple. The man had very severe Alzheimer's disease. In fact, I met him and he passed away all in the span of while I was writing the book. And he was so far into the journey that he could barely speak, and most of the time it was just grunts and groans. And you mentioned earlier, you try something and it doesn't work. Maybe one day it'll work the next. It was a great example of that because I was trying everything that I knew as a person who works with other people with dementia. I tried everything I could to try to connect with him, and he just wasn't. And one of the things he and his wife and I had talked about in advance was the possibility of sharing communion, the Lord's Supper, together, because that was a key part of their faith and their faith practice. And so even though he wasn't responding to anything that I said, we took the time to share communion together. So I read a passage from Scripture, and then we got out the bread and the juice, and we shared it together, and he took it, and it took much more time than it would take the average person, but we just slowed down and we waited and had some silence. And he took it, and he drank it, and he ate it, and then he looked at me, and he just said one word. He just looked at me, and he said, "Brother." And it was a real connection that we had there because this was something that met him where he was. It was a meaningful part of his faith journey to take communion, which is a practice which is all about remembrance of the life of Christ. And, once I got to know him better, I could find that this was a way to step in, but I had to be present to be able to do it first.
Mm-hmm. Wonderful. Well, I think it's just a critical piece, that it's not just about tasks, and it really is about engagement and being present. And so often I think we've lost. We don't know what that means really anymore. It's kind of an
Right.
Oprah thing. A lot of people look at it
right.
as almost being new age when actually it's very old school. About slowing down and being present and being
right.
a good person. One of the things that I like to in the book is, you have a list of questions for people to kind of reflect on in terms of, how would I want to be treated if this happened to me? I think going there is really important. How would I want to live my life? And how would I want people to care for me if I knew that I couldn't care for myself? All of those questions are brilliant, simple questions, but very hard to answer because most people don't want to go there, don't want to look at that. And then, as far as the church goes, you've talked about considering starting a support group. And, I was talking to one group, for example, and they said, our church has a group, and they meet down in the basement and where nobody sees them. And I said, I thank you for having the support group and providing that safe place. And I said, but I challenge you to put it where people don't have to feel embarrassed and
That's
don't
right.
have to hide it. And you may be thinking that you're doing this to protect the people, but I would really have you question why that's being done, because a lot of times it's our discomfort with it. Yeah. And we project it on them because that's what we hear that over and over from people is, I still want to belong. And, people who have cancer don't feel shamed that they've got a disease. And so we really have to reframe this differently. But in order to do that, we have to have the conversation more.
That's right.
We're not going to break that myth without doing that.
Yeah, and one of the things that it makes me think about is there's a lot of discussion around the world about dementia-friendly communities. And I think here in the U.S. we have a long way to go to catch up with some of the European countries who seem way, way far ahead of us. But one of the things that in a sense, I dream about is what would it look like if church communities became the most dementia-friendly communities around, so that if a person came into that church with Alzheimer's or confusion, that they would be welcomed there, and that would be a place where people could start to understand them and care for them well, rather than put them in the basement, as you indicated with your example. I mean, what a beautiful thing that might be. We all might believe different things, but I think we could agree that if communities of faith were to rally around this and to start to think about how could they be dementia-friendly, it would be a beautiful thing and incredibly helpful.
Mm-hmm. Well, and I think the thing that people have to realize is, the term caregiver makes it sound like we're giving everything away. And it's a relationship, and relationships are two-way. And I've always found what you give, you get back and more. But you have to look for it. If you're not going to look for the gifts, you're not going to find them. If you're going to focus on the struggles and the hardship, well, you'll find it. It's there. I don't think anyone's going to deny that. But there is a lot more to this disease besides just that. And so it's important for people to remember to look fully at what's before them. Well, this has just been a fascinating conversation. We have about 4 minutes left, and I just want to make sure that that you're able to talk about everything that you wanted to cover today. Is there anything else that you'd like to share with our audience?
I think one of the things that I would just like to mention in closing is that when we talk about a disease of forgetting like dementia and Alzheimer's disease, and we're talking about remembering God and remembering our stories of faith, we have to admit at some point we're all going to hit a point where we're going to forget, whether it's due to Alzheimer's disease or the demands of day-to-day care. And one of the beautiful promises of God is that we see that He promises that even when we forget Him and we can no longer remember, that He will always remember us and He'll always care for us and hold us in His hands. And I think it's a beautiful promise for me as somebody who's prone to forget, and I think it's a beautiful promise for others who are prone to forget, that God won't forget us.
Yeah, it's so nice to not, to know that you're not alone, and to have that peacefulness within. And again, not everyone believes, and we're not here to convert people necessarily, but a gentle reminder, because maybe they have forgotten their faith, and and that does happen with chronic illness. People feel like this isn't right and this isn't fair, and God or my higher power has abandoned me. And again, I would question. Have you questioned yourself what is it you are to learn, through this process? Because I think you'll be amazed at what God or your higher power has in mind for you, to improve not only your life but those that you care for in general, because these are life lessons, and I'm a firm believer we're here to learn our lessons, and just because we're done with school doesn't mean we're done learning, and so many doors of possibilities are available to us if we keep an open mind and an open heart and connected connected to our God. So I thank you so much, Dr. Mast, for joining us. I know that you have a Twitter account that people can find at Benjamin Mast 1, and I also have your university page on the website that people can go ahead and click on, as well as the Amazon link to purchase your book as well. So again, thank you so much. I hope you have a brilliant holiday, and I really appreciate you taking the time with us today to spend and talk about your book, The Second Forgiving.
Thank you so much. The pleasure was all mine.
Okay. Bye now.
Bye.
Last, I just want to remind people, if you are not part of the Purple Angel Project, I would recommend that you go to our website on Alzheimer Speaks, go to the About page, and click on the Purple Angel Project. There you'll also find out information about memory cafes and becoming dementia friendly and our dementia chat sessions as well. Again, one last shout out to Alzheimer's Disease International, the Alzheimer's Research and Prevention Foundation, HealthStar Home Health, the Lewy Body Association, the Association for Frontal Temporal Degeneration, and the National Aphasia Association, and Alzheimer's Music Connect. Thank you all. Have a brilliant holiday, and we'll be back next Tuesday.
It's time to rethink, renew, and reimagine retirement. Hey everybody, Jared Sylvester here, host of Retire Repurposed. Now, this podcast is about the non-financial parts of retirement, which many times can be even more challenging than the financial. We believe retirement is not the end, rather the beginning of what could be the most impactful, purposeful, and fulfilling season of a person's life. So don't retire, become repurposed. To listen now, search Retire Repurposed on your favorite podcast platform, Senior Resource, or Life Audio.